Hypertension, also known as high blood pressure, is often called the silent killer. This is because it can creep up on you without any warning signs. This is because it often shows no symptoms, making it difficult to detect without regular checkups. Yet, it can silently damage your heart, blood vessels, and other vital organs over time. The damage accumulates gradually, leading to severe health issues. Understanding hypertension is the first step towards protecting yourself from its devastating consequences. Knowledge empowers you to take control of your health. Blood pressure is the force of blood pushing against the walls of your arteries. This force is essential for circulating blood throughout your body. When this force is consistently too high, it puts excessive strain on your cardiovascular system. Over time, this strain can lead to serious complications. Imagine a garden hose with too much water pressure. It can eventually weaken and damage the hose. The same principle applies to your arteries. Similarly, high blood pressure can harm your arteries, increasing your risk of serious health problems like heart attacks, strokes, and kidney disease. It's crucial to remember that hypertension is a common condition, affecting millions of people worldwide. It does not discriminate and can affect anyone. The good news is that it's often preventable and manageable with the right lifestyle changes and medical care. Regular exercise, a balanced diet, and medication can help. By learning about hypertension, you can take proactive steps to safeguard your health and well-being. Stay informed, stay healthy, and take control of your blood pressure. Understanding the causes of hypertension is key to prevention and management. While the exact causes can be complex and vary from person to person, several factors play a significant role. One major contributor is lifestyle. Unhealthy habits like a diet high in sodium, saturated fats, and cholesterol can contribute to hypertension. A sedentary lifestyle, lack of physical activity, and excessive alcohol consumption also play a role. Genetics also plays a part. If you have a family history of hypertension, you may be at increased risk. Certain medical conditions like kidney disease, sleep apnea, and thyroid disorders can also contribute to high blood pressure. Additionally, age and race are factors. As we age, our blood vessels naturally become less elastic, potentially leading to increased blood pressure. African Americans are also statistically more likely to develop hypertension than other racial groups. Hypertension is often dubbed the silent killer because it typically doesn't cause noticeable symptoms, especially in its early stages. Many people with hypertension are unaware of their condition until it's detected during a routine medical checkup. However, some individuals may experience subtle warning signs such as headaches, especially in the morning, shortness of breath, nosebleeds, and facial flushing. These symptoms can also indicate other health issues, so it's crucial to consult a healthcare professional for a proper diagnosis. It's important to note that these symptoms usually only manifest when blood pressure is severely elevated or in the case of a hypertensive crisis, a medical emergency requiring immediate attention. Therefore, relying solely on symptoms to detect hypertension is unreliable. Regular blood pressure monitoring is essential for early detection and effective management. Untreated hypertension poses significant risks to your health, often without any outward signs or symptoms. This silent condition can quietly wreak havoc on your body, making it crucial to understand the potential dangers lurking beneath the surface. Over time, it can damage your arteries and increase your risk of serious cardiovascular problems. The constant pressure can cause the arterial walls to thicken and harden, leading to atherosclerosis, which restricts blood flow and can result in life-threatening conditions. One major concern is the increased risk of heart attack and stroke. These events can occur suddenly and without warning, often leading to severe disability or even death. High blood pressure forces your heart to work harder, which can lead to an enlarged heart or heart failure. This extra strain can weaken the heart muscle over time, reducing its ability to pump blood effectively. It can also damage the arteries supplying blood to your brain, increasing the likelihood of a stroke. A stroke can have devastating effects, impacting your ability to speak, move, and think clearly. Hypertension can also damage other organs including your kidneys, eyes, and brain. The delicate blood vessels in these organs are particularly vulnerable to high pressure. It can lead to kidney disease, vision problems, and even cognitive decline or dementia. These conditions can significantly impact your quality of life and require extensive medical care. The longer hypertension remains uncontrolled, the greater the potential for irreversible damage. Early detection and management are key to preventing these severe outcomes. Regular blood pressure checks and early intervention are crucial to mitigating these risks. Monitoring your blood pressure at home and following your doctor's advice can make a significant difference. By understanding the potential consequences of uncontrolled hypertension, you can make informed decisions about your health and seek appropriate medical care. Taking proactive steps today can help ensure a healthier future. Section 5. Preventing hypertension, taking charge of your health. While some risk factors for hypertension such as age and genetics are beyond our control, adopting a healthy lifestyle can significantly reduce your risk of developing this silent killer. One of the most impactful steps you can take is to maintain a healthy weight. Losing even a small amount of weight can make a big difference in lowering your blood pressure. Combine this with regular physical activity, aiming for at least 30 minutes of moderate intensity exercise most days of the week. Quitting smoking is another crucial step. Smoking not only raises your blood pressure but also damages your blood vessels, increasing your risk of heart disease and other health problems. Managing stress through relaxation techniques like deep breathing, meditation, or yoga can also contribute to healthier blood pressure levels. Section 6. Dietary approaches to lowering blood pressure. Diet plays a significant role in managing and preventing hypertension. By making simple yet impactful changes to your eating habits, you can effectively lower your blood pressure and improve your overall cardiovascular health. One crucial step is to reduce your sodium intake. Aim to consume no more than 2,300 milligrams of sodium per day, ideally less. This means limiting processed foods, fast food, and restaurant meals, which are often laden with hidden sodium. Increase your intake of potassium-rich foods, such as bananas, sweet potatoes, and leafy greens. Potassium helps counter the negative effects of sodium on blood pressure. Additionally, prioritize foods rich in magnesium, calcium, and fiber, as they contribute to healthy blood pressure regulation. Section 7. The power of exercise in hypertension management. Regular physical activity is an essential pillar of hypertension management. Exercise helps strengthen your heart, improve blood circulation, and lower your blood pressure. It also helps manage stress and maintain a healthy weight, both of which are crucial for blood pressure control. Aim for at least 30 minutes of moderate intensity aerobic exercise, such as brisk walking, swimming, or cycling most days of the week. You can also incorporate strength training exercises twice a week to build muscle mass, which helps lower blood pressure. If you're new to exercise, start gradually and gradually increase the intensity and duration of your workouts. It's essential to listen to your body and consult your doctor before starting any new exercise program, especially if you have any underlying health conditions. Section 8. Medications for hypertension. When lifestyle changes aren't enough. While lifestyle modifications such as diet, exercise, and stress management are often the first line of defense against hypertension, they may not always be sufficient. For some individuals, medications become a necessary part of the treatment plan to effectively manage their blood pressure and reduce the risk of serious health complications. Various types of medications work in different ways to lower blood pressure and reduce the risk of complications. These medications can be prescribed alone or in combination, depending on the individual's specific health needs and how their body responds to treatment. Diuretics, commonly known as water pills, help your body eliminate excess sodium and water, thereby reducing blood volume and lowering blood pressure. They are often one of the first types of medication prescribed for hypertension, and can be very effective in managing the condition. Angiotensin-converting enzyme, AC, inhibitors and angiotensin II receptor blockers, ARBs, relax blood vessels, and make it easier for your heart to pump blood. These medications are particularly useful for patients with certain underlying conditions, such as chronic kidney disease or diabetes. Calcium channel blockers prevent calcium from entering the cells of your heart and blood vessels, which helps relax and widen blood vessels, reducing blood pressure. These medications are often prescribed when other medications are not effective or suitable for the patient. Beta blockers, on the other hand, work by slowing your heart rate and reducing the force of your heart's contractions, which lowers blood pressure. They are particularly beneficial for patients with heart-related issues, such as arrhythmias or a history of heart attacks. Section 9. Living well with hypertension, a lifelong commitment. Managing hypertension is an ongoing journey that requires a proactive and committed approach. By embracing a holistic strategy that encompasses lifestyle modifications, medication adherence, and regular monitoring, you can effectively control your blood pressure and minimize your risk of complications. Work closely with your healthcare provider to develop an individualized treatment plan tailored to your specific needs and health status. Be an active participant in your care by asking questions, understanding your medications, and attending regular checkups. Remember that managing hypertension is a marathon, not a sprint. There may be ups and downs along the way, but with persistence, support, and a commitment to your health, you can live a long, fulfilling life despite this silent threat.